From the beautiful Finger Lakes region of upstate New York, this is the Dental Lighthouse podcast. We take questions from anyone in the dental profession and discuss what it takes to win not only in dentistry, but in life. Business, leadership, relationships, parenting, health and wellness, money management, nothing is off limits on the Dental Lighthouse podcast. I'm Jason Tanoory, your host, and have over 20 years of experience to pull from. Learn from my mistakes and let me help you collapse time so you can become the best version of yourself. Yo, welcome back. Dr. Jason here, Dental Lighthouse podcast. It is a beautiful Friday morning in upstate New York in the Finger Lakes area. And I am very excited about our guest today, dental hygienist, Cris Duval. Cris, how are you doing?
I am terrific. Thanks for asking, Jason.
Cris is a lifeguard approach coach. We're going to read her short bio here. A patient health advocate and wellness coach, Cris Duval has spent more than 4 decades in patient care as a founder of Lifeguard Approach. Cris focuses on helping dental and medical teams shift their mindset from repairing the damage to preparing patients for health. Cris describes herself as an architect of change. I love that. In dentistry's approach to oral systemic health, her ultimate goal is saving lives by both guarding and guiding health and wellness. And as we were talking about before we hit record, this mantra, this message, this philosophy is so near and dear to me on multiple fronts, as we have a fairly large dental organization just trying to change the mindsets of our dental hygienists, our doctors, and just making sure that they understand truly how valuable they are in the patient health ecosystem. So I'm really excited for this interview. Cris, would you like to unpack a little bit how you came about offering this amazing level of wisdom and what your background is?
Sure. Like I said, I've been a hygienist for many, many years. Probably I was seeing patients before a lot of your listeners were born. But I came to a point after about 28 years of seeing patients that I just burned out. At least I thought it was burnout. And so I did what any rational hygienist would do, decided I'm going to go work somewhere else. So I quit my job, and I found that wherever I went, the real me followed me. And so I got to that point where I figured out that what I had to do was I had to make some changes myself. I couldn't look to my patients or the practice. I just wanted to become better at taking care of patients and being happy doing it. And I wanted to see some results, because when I quit my job, what really caused me to quit my job was more that's called moral injury than burnout. And moral injury is where, for me, it was I lost my impact and influence with my patients. So what I was telling them and recommending that they do and trying to coach them into doing, it wasn't working. So I had to reframe everything. And I found that I was mostly repairing the damage on patients. And I needed to develop a different approach. So I had to go back to work after I quit my job, but I decided I was going to position myself with someone that had a very different view of patient care. And I went to work for a doctor in Seattle named Dr. Brian McKay. And he changed my life because he had enough belief in me and potential that he helped me create that change. And he did that by taking me to lunch the first week I was there. And this isn't what he said, but it's what I heard. Do you know the difference between the two of those?
I certainly do. And I ask my kids that all the time.
Yeah. What did you hear me say? Yeah. And so what I heard at this lunch was, he said, I thought, I want you to paint a bigger canvas of who you can be for our patients. And he says, my interpretation was that he wanted me to start a wellness program. And now realize this was almost 25 years ago. And so there was no one out there doing that. And so I just decided I'm going to have to figure this out. And with him walking beside me and guiding me, what was developed was the lifeguard approach. When I was 14, I was a competitive swimmer. And I won every race that I entered in. And I was at our home pool in a competition one day, and I swam a race, and I turned around and leaned against the back of the pool waiting for the other swimmers to finish. And I blew a great big bubble. I swam that race with 4 pieces of double bubble gum tucked underneath my tongue. And when I got out of the pool and started to exit the pool, unbeknownst to me, the lifeguard had gotten off of her perch, and the timer in my lane was a physician that knew me. And they stopped me on the way out of the pool, and they said, do you want to live to be an adult? Because that was a really stupid thing to do. If you had aspirated that gum during the race, you would have gone dead in the water. We wouldn't have known what had caused it, how to help. You would have been in deep water at that point.
No doubt.
So I've always kind of had that in the back of my mind. And I realized that our patients can be exactly like I was. They can be doing some things that aren't too smart. They can be including things in their lifestyle that could put their life at risk. And so I decided to develop my wellness program in a sense that I could help guard and guide the patient's health and wellness, because my ultimate goal was to help them save their own life. I didn't want to be, kind of a dictator that said, you got to do this, you got to do that, pointing my finger at them. I wanted to be able to help them understand the science enough and have enough communication skills, or my messaging, I call it messaging, not communication, that I could help them make their own decisions. And so that's what I did for many years for Dr. McKay. And it turned out that, the statistics, they tell us that is about 80% of the population show evidence of gum disease by the time they're, 60 or over. And so my amount of periodontal related codes that came out of my hygiene department it varied between 78 and 82% per month of the patients that got a code that was really indicative of a procedure that could help change their life. And they chose that by understanding what the science was telling us today and how we could mitigate those risks.
That's an amazing backstory, and I think a tremendous amount of context that can lead us to the rest of this conversation. So I very much appreciate that. At a 30,000 foot level, if we were talking to a lot of our listeners who probably have the mindset of, okay, I've read the literature, I'm aware that there's a strong connection between oral health and systemic health, but I'm struggling with implementation. I'm struggling with, where do I begin? What typically are first steps if you are privy to work with someone who wants to do the right thing, but is just struggling to figure out how to take that initial step?
Well, for me, it was, and what I'd recommend for them is to change their thinking. And the biggest thing, the most impactful thing that I did was I let go of the stranglehold that traditional hygiene had on me. In other words, a hygiene appointment is about calculus removal. It's not, in my opinion. It's about identifying risk factors in a patient, and then how can I communicate that based on science to where they'll make a decision of what they'll choose for themselves. You see, every patient wants one of two things. They either want to move towards the benefit of health, or they want to move away from the consequences of disease. And all I had to do was find out what they valued. And so I would encourage anybody that wants to maybe take a different approach and have more of an impact and influence. And for me, this allowed me to regain that impact and influence, because what I was telling patients to do wasn't working. You just need to brush and floss. Well, we now know that's not all that you need to do to stay healthy. And just let go of that stranglehold. We haven't had anybody that's died from a calculus infection at this point. But the great thing was when I started this approach and started moving into thinking, what can I do to prepare this patient for health for tomorrow? And more importantly, how can I help them be healthy when they come back to see me in 3, 4, 6 months? So that just change your thinking from repairing the damage to preparing for health. And that has to start with you. That has to start with the hygienist. And I might add, I think it has to also be an important part of what the dentist wants their hygienist to be. So, yeah. And you have to decide, they have to decide very firmly as to who they're going to be for their patients. If you want to be just somebody that goes to work and chats and polishes all day long and walk out the door at the end of the day, that's up to you. That's a choice you make. It might not fit in with the goals of your dentist, of what he wants for his patients. But you just got to decide who you're going to be. And I made that decision at that day that I was going to be like that lifeguard and that physician in my lane. There you go, kind of the oral systemic link. I was going to be like they were. They could have let me walk out of the pool area and just said behind my back, "Stupid girl."
Yeah, just so much wisdom there, Cris. And a couple things that just come to mind. First off, I love that you've referenced impact and influence a couple of times. It's actually one of our core values in our organization is impact and influence. And in this realm, it really hits home because sometimes I feel / worry that my clinicians don't realize the level of impact and influence they either have or could have for the patients that they're blessed to see. And they have heard me say multiple times that patients are seeing you significantly more than they're seeing their primary care physician, significantly more than they're seeing any type of medical specialist. And what an opportunity to educate, to influence, to create a level of impact with the patient that you have the opportunity to spend the next 60 minutes with. And how you choose to spend that next 60 minutes can really make a difference. Now, to your point about what the hygienist or dentist or dental practice ultimately wants, I truly feel like there's no right or wrong. It's just what your philosophy is. And I do feel like it's freeing for the team to understand that philosophy, and it has to come from the owner, has to come from the dentist. So when you were able to meet with this dentist in Seattle and have clarity on what your level of impact and influence could be, I'm sure it was so refreshing for you to hear and just be able to to be able to fulfill that void that was in your life, as you had previously described.
Yeah.
So let's assume that the dentist, the owner, is 100% on board with the message that you're preaching. And let's assume that they have tried their best to over communicate to their dental hygienist about the direction that they want to take the organization. What are some first steps that the dentist would need to do to help the hygienist adopt this philosophy of health compared to, let's call it, the traditional philosophy that has been, that's more antiquated or has been practiced up until this point?
Yeah, absolutely. That is, do what Dr. McKay did for me. Essentially, I viewed him taking me to lunch and what I heard as a challenge. So I think the best thing to do is challenge your hygienist to develop a way to paint a larger canvas of who they can be for their patients. And let me tell you, it will do amazing things for them to just know that their dentist doesn't expect them just to scrape and polish all day long. And I think the other thing they can do, give them a challenge and then have them really understand that the more you know about your patient and what your patient values, the more they think you'll know about dentistry. So what I did was I shifted just about all my communication. I had to come up with new quality questions that were in line with what my patient values and what the science is telling me, what the patient wanted for themselves. And you might as well take a 3-inch piece of duct tape and put it across my mouth if I don't know what a patient wants for themselves. And I come right out and ask them that question. Tell me about what you want for yourself. I'm here to help. I'm here to help coach you to get that, because we know if you have a coach for something, you're going to get it, the concept better and faster, and it's going to be more lasting. So, yeah, I did things like, I absolutely detest when a patient comes into your office and you walk out there and you say, "Hi, how are you today?" "Oh, I'm fine. How are you?" What does that tell you about what your patient values? And I am a value hunter. I hunt in all my communication, excuse me, for what that patient values. So what I did instead, I shake hands and or give the patient a hug, depending on the level of how I knew that patient. And I say, "Thanks for coming to see us today. And as we're walking back to my operatory, tell me about something great that has happened in your life." And not once have I had somebody tell me, "Oh, I took a big check to the bank," or anything related to that. It's always about, "I'm so excited. I just had my first grandchild. I'm so excited. My husband is free of cancer right now. I'm so excited. My kids have moved back to the area where we live." And you see, that gives me a absolute and distinct clue into what that patient values. And so when I know what they want for themselves, I want health. I want to be as healthy as I can possibly be, or I want to avoid having a swollen face like my brother. All I have to do is combine those values that I've hunted out and take their risks that they have. And I have to just kind of congeal those and figure out, okay, here are your risks. Here's what you value. How are we going to get to the point where we can mitigate and eliminate those risks so I can help you live a long and healthy life and be here for that new grandchild throughout their life.
Yeah, love it. Absolutely love it. So assuming that we have clarity that the patient is interested in health, and assuming that's just not lip service, like you can truly buy into the fact that the patient wants health. You had referenced a few times mitigating their risk profile, risk factors. I'm assuming that you mean information that you would unearth from a review of medical history, from a review of familial history, whatever genetic predisposition this patient has. Is that safe to say?
Absolutely. That's the primary thing. And so what happens is when you take your risk factors and you have what they value, what becomes the primary focus of a hygiene visit is not calculus removal. It is life-saving screenings. And I can truly say that I did an oral cancer screening on every patient at every time throughout my whole career. My second patient in hygiene school and clinic was my husband's grandfather. And I found what turned out to be on him oral cancer. And so I realized at that moment that every patient that sits in my chair has probably a plethora of people that love and care about that person that's sitting in my chair. So it's my responsibility, my duty, and the oath that I took to do whatever I can to make sure that I did a life-saving screening, an oral cancer screening on every patient at every time. And to me, that is the purpose, and the evolution of a hygiene visit is not about calculus removal, but as you decide how you're going to take care of patients, what better way can you take care of patients than preparing them for tomorrow by doing life-saving screenings, blood pressure, check the health of the biofilm. Sleep disordered breathing, that's a huge one that takes lives. I can't begin to tell you how important it is to make this shift, because when you're just focusing on calculus, you're repairing the damage. And I want to prepare my patient for health with life-saving screenings. And I've cracked the code at how to have time in the appointment time for life-saving screenings.
Well, you can't drop a cliffhanger like that and fail to unpack it. So is now the right time for you to share with us how you've cracked the code?
Yeah, well, I'll just tell you, number one, I stopped seeing calculus anymore. I didn't see calculus, and it all focused around me balancing their biofilm, helping them create a healthy biofilm. I was in Chicago at the midwinter meeting in 2006 when Tom Neighbors launched Oral DNA. And the practice has been doing oral DNA or different varieties of pathogen testing since then. It is one of the mainstays. That's a life-saving screening, is checking the health of the biofilm. I check the biofilm with a carry-free screening on every single patient every time I saw them.
So let's unpack this at a more granular level now. And I so appreciate kind of how you've described the situation from a high level. And then if we were going to get tactical, let's say on a typical appointment, and I'm just going to speak from my own knowledge base. It could be full of ignorance. If it is, please correct me. So we're bringing a patient back. We're trying to determine their value system. We're assessing their risk for health based on their medical history, based on their familial history, based on their genetic predisposition, based on their blood pressure, based on screenings that you've already described, airway, all 100% on board with that. And then you start not necessarily the clinical parts of the exam, not necessarily probing or scaling or what have you, but you start to notice just in, let's call it an inordinate amount of inflammation, bleeding upon probing. Let's say half the mouth typically is bleeding. What we like to say in our organization is bleeding is not normal. So when you see someone that has that level of inflammation, and that immune response, what does the conversation look like, between the two of you 10, 15 minutes into the appointment?
Well, let me back up a little bit because Dr. McKay's office was very different in how we say managed a new patient. So they had a combination of 3 appointments as a new patient. And people will go, oh, my patients will never go for that. Well, it worked extremely well. So the first visit was spent with the patient care coordinator, who spent however much time it took to find out what the patient's story is. Everybody has a story. Everybody has wants and goals for their mouths. And so she would meet with the patient first. Then she would introduce me to them, and she would share with me some of the information that she learned. And then they would see me. And then after they were had their hygiene visit, and most of the time I did a prophy, but we talked about and scheduled periotherapy at that visit. And then they would see Dr. McKay after they saw me on a separate day. And it just gave you, and it goes back to that statement, the more you know about your patient, the more they think you know about dentistry. And get that into your brain, because it is so true. And you have problems with the people that you jump the fence and you don't know about them enough. So I would have conversations. One of the first things I'd say when I would be in with a new patient when I saw them is, here's what Jody has told me. Let's talk about from a clinical standpoint. Tell me about what you want for yourself. Well, I want my gums to be healthy. Well, instead of me saying, do you brush and floss, or how often do you brush and floss? I didn't even go there. I started with, tell me about when your gums bleed. Because I don't care how much they brush and floss, but I do care about when their gums bleed. So conversation and the messaging would go up from there. Well, you told me that your gums bleed when you floss. So here's what we now know about that and how it impacts your general health. And from your medical history, you have indicated that you had a father that died of a heart attack at a young age, and that you now have some cardiovascular problems. So let's talk a bit about how that impacts, bleeding gums impact cardiovascular health. And it's just a natural evolution of, oh, here's what they value. Here's what their risk factors are. Let's combine those two. Done with science.
Yeah, I love it. 100% on board with everything that you just said. I find that, at least with my doctors and my hygienists, that the new patient, they have adopted this mindset, which is, to your point, the first domino that needs to fall. I have found that practicing this mindset with the new patient is significantly easier than practicing this mindset with a patient that's been with us for 15 or 20 years, where we were practicing, let's call it an antiquated model. So yes, I 100% am on board with what you're saying regarding the new patient. If we're talking about a recall patient who has had a history of inflammation, mild to moderate attachment loss, to your point, not significant buildup, but we've determined that their biofilm is anaerobic. What is the conversation and what is the ultimate treatment philosophy in your eyes to help that patient become healthier?
Well, for what I did was when I would have a patient come in that I'd been seeing for a while or years, didn't matter. When I started doing this, I started saying, again, my messaging was different. And I would simply say, your hygiene visit with me today is going to be distinctly different than you've ever experienced.
Love it.
And this is why. So I talk about the science. We now know. And this is what it means to you is the third part of that conversation. So this is how I'm going to treat you today is distinctly different. This is why it's going to be different, because we now know that how we've been taking care of you just isn't good enough anymore, according to what we now know. And here's what it means to you.
I love the phrase "we now know." It just creates so much authority. Is the authority legitimate or not? Who really knows? But I just love the phrase "we now know," because I do feel like if the clinician does truly now know because they've been educated on the latest research or techniques or what have you, then I do think it positions themselves in a great way with the patient who we have now determined values health.
Yeah. So one other thing we did, if I could just interject here, is we had a wants sheet that everybody filled out, and we would update that every so often because patients' wants can change. And it was a lot of what their motivators are. I had to know their motivators. And so when you combine that, it just simply makes it so much easier. And I started a wants motivator that we put on, we used Dentrix at the time, and we put patients' wants on the patient's notes. So when we printed out a route slip, every single team member could see and learned what the patients that they were going to be seeing that day, what they wanted for themselves. And, I go back to a couple patients. One was an attorney. He came in and he sat down in my chair and he said, "I don't want x-rays today." And it was time to take some new x-rays. And I said, "Well, why not?" And he goes, "I don't have time." And what I knew from him by looking at his want sheet is one of his motivators was he wanted precision healthcare from us. He wanted things done at the right time for the right reasons. And so I just said to him, "Hey, I know time is important to you. You have a busy schedule. If I can promise," well, first I asked him, "How much time have you allotted for your appointment today?" And he said, "An hour." I said, "Great. If I can have you out of here right on time, will you allow me to take x-rays so that we can use those to evaluate your health? Because I know health's important to you." "Oh, yeah. Okay, go ahead." And so you just have to, again, there's a value thing. You just got to use and combine those values and your risk factors. Another one was a woman that Her teeth were literally falling apart. She had all these anterior restorations that were cracking and failing. And this was early on when I started work for Dr. McKay. And I went to him and I said, oh, you got to help this patient. Her teeth are really kind of jacked up. And he said, well, what does she want? I said, I don't know. And he goes, turns me around, go back and find out.
Yeah, I love it.
So I was talking to her from an aesthetic point of view, and she did not value aesthetics at all. What she valued when I finally took the time, this was before I developed this wants monitor, what she valued was function. She would not give herself permission to have a complete restoration until it met her wants and her desires. She didn't care what her teeth looked like, but she cared more. She cared a huge amount about how they functioned. So once I was able to show her how we could stabilize these teeth and you bring them back into great function, she was all on board. And as long as I was talking about aesthetics, nah, she didn't want to have anything to do with it. So it's about knowing your patient.
Amen. Amen. I love stories like that. We often talk to our treatment coordinators about a patient who was presented optimal treatment, but chose to say no. And the treatment coordinators almost always go to money. Well, they thought it was too expensive. And I was like, well, you're placing your bias, your perspective, your paradigm on them. And when you have the patient back and you start to unpack things a little bit more, don't get me wrong, sometimes it could certainly be money, but more often than not, it's fear. And how are we going to deal with my fear or anxiety? Or it's, I have a friend that had a procedure done that sounds similar and it didn't go well. So I'm scared that it's not going to be successful. So to your point, unless we ask the right questions and unless we really truly find out what their value system is, it's really difficult to provide solutions unless we know what the problems are.
You're only assuming.
100%.
And you know what happens when we do that?
100%.
Yeah.
I really appreciate the wisdom here, Cris. And I'm, selfishly, I'm excited for my own hygienists to listen to this and to help them on their journey about becoming the best advocates that they can possibly be for their patients. I know our listeners are probably going to have questions about more of your philosophies and how they can reach you. And as I shared before I hit record, in preparing for this interview, I listened to a number of podcasts that you had been on, and this thing could turn into a 5-hour interview where I was understanding your treatment modalities in terms of ozonated water and in terms of how to deal with certain levels of periodontal infection, salivary testing, microscope biofilm testing. I mean, just you name it, right? So if they wanted to kind of dig in a little bit deeper to your treatment philosophies, modalities, and stuff like that, what's the best way for them to reach you?
They can reach me at Cris, and it's Cris without an H. So it's CRIS at thelifeguardapproach.com. And my website should be up next week. We've taken it down and are redoing it. So, yeah, I'd love to hear from somebody. You see, I'm a woman of faith, and I believe my gifts, well, it didn't hurt that my dad was a motivational speaker. But, so I think I got a little bit of his mantle, but I believe I know where my gifts come from. And my goal is I don't want to leave this earth without a single gift that I've been given unshared. And
that's super powerful.
Yeah. So I don't want any arrows left in my quiver. I mean, you can put my quiver in the casket and say, good job, I'm hoping. But because it's going to be empty. So any any way I can help, I love to talk about this. If there's any teams that would like to have me come and talk to them, or any of your group, I would love it. So I'm just out there to help. I'm trying to help make life better for hygienists. I mean, by the time I retired, and I did so because my husband had some health problems, I have never been so excited about hygiene. Total 360-degree difference from when I quit my job, because I thought I had burnout, but it was moral injury. And you should check out what moral injury is, because that's another thing we can talk about all day. But
yeah, no doubt. No doubt. Well, again, thank you so much for the time. And I know you're busy, and I appreciate you carving out a little bit of time to talk. And I'm excited to get this episode out into the universe, so a lot of dentists and hygienists alike can benefit from your wisdom. So thank you so much.
You are welcome.
Thank you. That wraps up another episode of the Dental Lighthouse podcast. You have a choice today. Choose to be a lighthouse. Lighthouses are powerful and steadfast. They are beacons of light for others to reference when life gets turbulent. Go out into the world today and become a lighthouse for someone. Give more than you get. True joy comes from serving others. Start today. I'm Jason Tanoory, your host. Thank you for listening to the Dental Lighthouse podcast. For more information, podcast show notes, or links to anything that we have discussed today, please check out our website, thedentallighthouse.com. We would love to hear from you. If you would like to get on the show, please email us at podcast@thedentallighthouse.com.